Hi, Curt Sigmund here. I'm Vice Chair of the Council on Hypertension, and I'm joined by Jan Basile, who is the Vice Chair for Clinical Programs on the Council of Hypertension. And we're here in New Orleans for the Hypertension Sessions 2019 meeting. It's really been an incredible meeting this year. I'm really excited about the program. We've been getting really positive comments from the attendees. And I'm wondering, Jan, if there's anything that really struck you as particularly fascinating from this year's program.
Curt, I am just delighted with how the program went down. Couldn't have asked for more from the program committee. We had a number of great debates, and the most important maybe and controversial debate was between Bob Carey and Sanjay Kaul. And Sanjay Kaul believed that the less than 130/80 target should not be the target recommended, and Bob Carey felt it should be. And Sanjay felt too much information was placed on the sprint trial within the overall analysis, and Bob Carey showed many meta-analyses, including and not including the sprint trial, that still showed that less than 130/80 is the best target for patients with hypertension. That was exciting. Then we had another exciting debate between Paul Welton and Brian Williams on which drug should be given first. Dr. Welton went through the evidence and believed that either a thiazide-like diuretic, a CCB or an ACE or an ARB, but not both, should be the first drug. And Brian Williams said, forget about it. We're recommending in the ESC 2 drugs as initial therapy, so I don't even want to debate which first drug is best. That was awesome. We talked about blood pressure measurement. It all starts with the measurement. Everything we do for our patients is based on the measurement. We talked about office blood pressure as a screening test, home blood pressure as a confirmatory test, and how important home blood pressures are to monitor and follow up our patients with hypertension, although ambulatory blood pressure is still the best predictor of events. But daytime ambulatory and home blood pressure correlate very well with one another. So when you can't get an ABPM, home blood pressure will be an important measuring device. Big session on women and hypertension, and very important. Basically, women are treated similarly to men in hypertension, and their targets are the same. We talked about pregnancy and hypertension, labetalol, hydralazine, and alpha-methyl-dopa are the 3 drugs, no RAS blocker. There was some controversy about still using methyl-dopa, but it's still on the list and is still recommended as one of the 3. We talked about diabetic hypertension. That was very interesting, and the importance of SGLT2 inhibitors and GLP-1 receptor agonists. The first more significant blood pressure reduction than with the GLP-1 receptor agonists. You get a little weight loss, you get A1C control to prevent heart failure, to prevent and control renal disease, and the ESC has just moved GLP-1 receptor agonists and SGLT2 inhibitors to be used before metformin, while we still say in the diabetic metformin first. Very, very exciting. And then finally, just a word on resistant hypertension. If you have patients with resistant hypertension, you have to make sure they're adherent to therapy before you call them truly resistant. And don't forget about the importance of chlorthalidone over hydrochlorothiazide and mineralocorticoid receptor antagonism with drugs like spironolactone and or eplerenone or amiloride as additional drugs. A lot of good information for the clinician treating patients with hypertension.
That's fantastic, Jan. The excitement is palpable. I could feel it.
Thank you.
And yet we had a lot of really exciting programs, particularly in the recent advances sessions this year, where we really tried very hard to describe both a basic science concept and then the translational aspect leading to clinical medicine, which I thought was really successful. A good example of that was the circadian rhythms section in chronobiology. session, Dr. Gums provided some basic fundamental mechanistic information on how clock genes regulate our circadian rhythms. They discussed the aspects of the dipping of blood pressure, which occurs nocturnally, and then, of course, the morning surge in blood pressure, which is a risk factor for cardiovascular mortality. So we heard a lot about the fundamental mechanisms, and then Dr. Rahman did an evidence-based discusussion of what is better for either daytime or nighttime administration of antihypertensive therapy. And I think we all recognize this remains a study under active investigation and has not really been fully settled. But I think the idea is if you can enhance the dipping phenotype and mitigate some of that morning surge in blood pressure, may mitigate risk along the way. Right. Another really exciting session were the session on the microbiome. And we had two separate presentations on the microbiome, and then we also had a third talk on the microbiome by Dr. Bina Joe, who was our Harriet Dustin awardee for the year. And it's becoming really clear how important the microbiome is. As you know, that our bodies are made up of about an equal number of cells, of human cells and bacterial cells. And there's an incredible richness to the bacterial diversity that lives in our gut. In fact, there's a lot more genomic information that's encoded by the bacteria than it is from human genes. And it's pretty clear that our behaviors, our nutrition, our activity, and of course, the intake of salt regulates the type of bacteria that in our guts, and they make all kinds of metabolites which influence our hosts, us, and have influences on blood pressure. So I have a prediction that the microbiome is going to be the next hot area of basic science discovery in the council. I think it's going to be like in previous years, the surge that we saw in oxidative stress mechanisms, followed by the surge in immune and inflammatory mechanisms. And in fact, when you look back on the studies of inflammation and everything we now know, Dr. Mina Matur from Vanderbilt gave a great presentation describing the development of potential new therapeutics that are directed at minimizing the damage that's caused by the immune system in hypertension, but preventing any type of overall immune function, which will compromise us in the case of other diseases like colds and viruses and things like that. So I have a suspicion that the next few years will see a big increase in microbiome research, and it's very likely that we're going to see a lot more of that research presented next year. So with that, I would invite you to the Hypertension Sessions 2020, which will be on September 10th to 13th, 2020, right here in New Orleans again.
Right.
We'll see you then.